So if you are moving to Idaho and you are in your mid-60s, the question that you have is, what about Medicare? How does it work here in Idaho? What plans are available? How much does it cost? What's our healthcare system like here? What should I consider when thinking about Medicare? So I sat down earlier this week with Richard and Christy Jones from Jones & Jones Health Insurance Solutions. They deal specifically with Medicare in Idaho, and they answer all of those questions. So thanks, Richard and Christy. Really appreciate you sitting down with me. And they wanted to make it clear to you guys watching as well that if you have any questions, please feel free to reach out to them. They'd be more than happy to chat with you. Let me just kick it off. How does Medicare work in Idaho, and maybe just kind of talk a little bit about, Medicare in Idaho.
Okay. Well, Medicare is a federal program, so it's going to work the same as far as A and B in any state. But what changes when you move is your primary residence, so you'll have to have a plan in that service area. So that's where the changes come in. You can make a change 30 days before you move, or you can make a change up to 60 days after you move. So I don't really recommend after. That's usually when people forget that they have to make a change, because if you're on a plan that has a restricted network in another state, and then you move to Idaho where that plan is not available, I have clients that have trouble getting their prescriptions, making a doctor's appointment. So really, as soon as you know that you're going to move, I suggest talking to a local broker and just seeing what all of the options are.
And so what is it that exactly you do? Somebody calls you up on the phone. What are you going to start walking them through?
So we can help in several ways. We can help them with signing up for Social Security when they're turning 65 and initially signing up for Medicare. The most important thing is making sure that people can see doctors in their new area, making sure they're on a plan where their prescriptions are covered, and comparing the various plans in Idaho to make sure that their personal needs are taken care of.
And I would also say it's not just when you move states. If you move counties and you're on a Medicare Advantage plan, that new county might not have the same Medicare Advantage plan. So you have an opportunity, a special election at that period, at that time, to look at other plans that may be appropriate.
So even county to county, so
Yes.
from Ada County to Canyon County?
Correct.
Ada and Canyon are the same, but
Okay.
I have had several clients that retire and move up to Valley County.
Okay.
So we have to change their plan because the plans here are not available in Valley County.
Let's get into that a little bit then. Can you maybe just walk us through, we're going to do kind of a high-level flyover, obviously. We can't get into the weeds too much, but maybe can you tell us just a little bit about just different plans available? Maybe give us some sort of a ballpark on how much people should expect to pay, kind of maybe for the premium or those kind of things.
Yeah, so it depends on what kind of plan you have, first of all. If you are talking about just a Part D plan, you might have a Medicare supplement.
So what's Part D?
Part D is for drugs.
Okay.
And if you have a standalone plan, you're moving from, for instance, California to Idaho, that company might not be available, so it's good to check with a local broker and see if it is. If it's something you can just call and transfer your primary residence and get the new plan, that might be an option. Same with Medicare supplement, if it's a Plan G. Sometimes we'll have clients that they have a supplement and then they move and they want to change to a different type of plan, a Medicare Advantage plan. Maybe their supplement price has gotten so expensive that they can't afford it. So then we'll go over the different options with Medicare Advantage.
One of the first things we do is just sit down and talk about where they are in their healthcare journey.
Okay.
Some people hardly ever use their plan, they hardly ever go to the doctor. Other people have chronic conditions or certain things that need to be taken into consideration. We'll look at doctors, we'll look at prescription drugs and what those costs may be on the various plans, the network, and then after the fact, then we look at the co-pays and what would it be out of pocket for some of the services that they would use on a regular basis, and then we make some recommendations.
I know there's some things you can't talk about, right? But can you give us a general idea of how much to expect to pay for maybe a basic plan, the most basic Medicare plan?
Well, Advantage plans range anywhere from $0 per month to over $100 per month.
Okay.
Based on the plan and the company. Medicare supplements are going to be generally around $200 if you have a plan G. But if you hear any of the letters K, L, N, those are all supplements, and they all have various prices per month.
Because there's
and
going to be
copays.
different things that you
Yeah.
get out, right? You can-
Right.
Yeah.
So,
But, and I would say this, the K, the L, the Gs, a G is a G no matter what company you're with. It covers the same. However, the prices vary. So it's important to shop around. But when it comes to Medicare Advantage plans, if you have a 0 premium plan, then you can expect to have higher copays.
Yeah. Right.
You're just sharing the cost. But that doesn't mean a $100 a month plan is going to be better than a 0 premium plan. It depends on the benefits within the plan and how you're going to use the plan. So we have a lot of clients that say, we go to the doctor once a year, put me on a 0 premium plan. Well, that's great for them. They have the coverage they need, but they're paying very little on a monthly basis.
But then pretty much every time they go to the doctor, it's straight out of pocket, or a lot of it is.
well,
gonna be
it's
out of
just a
pocket.
copay.
Yeah.
Yeah.
Well, okay. Yeah.
Yeah, it's like a specialist could be anywhere from 0, depending on what you're seeing them for, up to $40 or $50 for a specialist copay, rather than 100%
Right.
that they would be paying.
Yeah. The nice thing about Medicare Advantage plans is that the preventative services typically are 0 cost out of pocket. They want you to go see your primary care physician on a regular basis, so typically those are 0 cost when you go. Your annual screenings and different things are covered at 100% as well. So I like to say the difference between, say, Medicare and a Medicare Advantage plan is Medicare will fix you when you're sick, takes care of you when you're sick, where a Medicare Advantage plan, they're trying to prevent you from getting sick, and so they're paying for those things to keep you healthy.
And that's to their advantage, right? I mean,
Absolutely.
Right,
Best
yeah.
defense is good offense. So
We always say advantages over original Medicare, so they typically offer dental, vision, and hearing, and gym membership, although some supplements offer a gym membership too, which is great. But the Advantage plans have advantages over original Medicare. So I think just educating people and letting them know what their options are, and then saying we can help you no matter what you decide. We don't push anybody in a certain direction because it's just highly individual.
For sure.
So I think it's important for people to know that when you work with a broker, you need to work with somebody that you know, like, and trust, because you want to be able to get a hold of them if you have a claim issue or any kind of out-of-network, in-network. And they can sign up online, but then they'll call a 1-800 number if they have questions.
Right.
So that personal service, which you know as a realtor, it's
Right.
very important.
For sure. Yeah. And you were saying off camera, I mean, you're not, if somebody calls you up, you're not like committing to like paying you a certain amount of money for
No,
a
no,
certain
our
amount of time or
clients
anything.
never pay us.
Mhm.
So that's what's good. We get paid like home and auto insurance agents, where we're contracted and licensed with several companies, and then whichever one works best for our clients, that company pays us to take care of them.
Idaho doesn't have huge cities. Boise has what? The Treasure Valley has 750,000 people, I think. How would you like summarize what our healthcare system is like here in the Treasure Valley?
Well, there's a lot of people retiring that are on Medicare that are coming to the Valley. So what that's done is it's sometimes hard to get a doctor's appointment. So that's another reason, have somebody, have a broker that can help you. You know, this doctor is not taking new patients. Can you recommend somebody? We do that all the time. And moving here, finding a new dentist. The healthcare, Medicare in general has had some big changes just in 2025 with the prescription costs. They're capping out at $2,000, whereas last year it was just over $8,000.
Oh, wow.
So it's definitely changing, sometimes month by month with certain companies.
And what it's done is when they reduce that to 2,000, especially with Medicare Advantage plans, they need to make up that difference. And so we've seen copays increase in certain areas with certain companies. We've seen companies move out of the state because they decided that they can't do business in the state. So Medicare Advantage is growing, and it's a fantastic option. But it is important, as you said, to look at the healthcare network here. Maybe to get on a plan that has a national PPO, where if you have a chronic condition in Idaho, you may not have that physician or that specialist in Idaho that can take care of that. So you want to have a plan that is flexible, and you can go to the Mayo Clinic if you need to, or you can go to the Huntsman Cancer Institute if you need to. So those things are important. And that's why when we meet with people, we really ask a lot of questions. Where are you now? What conditions do you have? What help do you need? So that we can make sure and put them on the right plan.
And you guys work not only in Idaho, right?
We're in 23 states.
23 states.
Yeah.
Wow.
We didn't
have
start.
to update our
Yeah, we didn't
state
start
map
by
here.
wanting to be in 23 states.
That's cool.
Yeah, there's a few
We
more
just
that
added
we've just
3
added.
more.
But we have, our clients refer us to their family and friends, and we want to help them, and we just grow. So we're very thankful.
That's great. I love it.
Yeah.
Well, thank you I'm sure people have more questions. As I said, I'll put their number or contact info on the screen there, and you guys can just reach out to Richard or Christy if you have questions. And thank you for sitting down with us.
Yeah.
Thank
really,
you.
really
Thank you for having
informational
us.
and really liked it.
Yeah.
Thank you.
Appreciate you.
Okay.
Thank you.